Greetings, everyone, and welcome back. We are here again. My name is Shola Ade, and I am the founder of MBS Complete. So, in this series, as I mentioned last week, we will be working through the different aspects of trauma, of trust, and how to really grow through those experiences that we encounter. So last week we talked a lot about trust, how trust can impact our relationships, how trust can impact how we deal with ourselves, how we learn, how we understand our experiences. And also we talked a little bit more about what to do when we find that we have difficulty trusting others, how to work through the aspects of acceptance and forgiveness. And so, going a little bit deeper now, let's start talking more specifically about trauma. Because in those experiences where we learn that it may not be easy or beneficial to trust others, we also get to the point of, well, what has actually happened? Why is it so painful to trust other people? Why is it so painful to trust things like our intuition, the part of ourselves that know what we need, but we may not listen to that? And a lot of times, what happens is we go through those traumatic experiences. Now, trauma in this day and age, it is definitely talked about a lot. And so, with a lot of these perspectives that we have, there's also the other side where it can be difficult to really define and to pinpoint. So, we'll keep it simple, right? Like I said, it can be defined in many different ways across disciplines, across ideologies. However, there are some common similarities that bridge all of these disciplines together. And a couple of things that stand out in regards to these trauma definitions is the fact that it is the mental or psychological breakdown. It also can be a cognitive breakdown or a breakdown of your thought processes, as well as some physical impacts, not to mention the spiritual and also the social impacts of that experience and those experiences. And so we look at the mental, the spiritual, the physical, the social, the cognitive, all of those aspects of ourself, the pieces that make us who we are, they experience a sort of separation. They experience a breakdown. They experience a disconnection from each other. And so with that, we now see trauma, of course, affecting ourselves. We can also see it be affecting our family. It can be experienced within our family where we have, again, this disconnection and this separation within family due to those traumas. And also, in regards to that familial aspect, it can also be intergenerational in the sense that these traumatic experiences that one generation has, it's now passed down into another generation and passed down into another generation. And so what happens is these breakdowns, so to speak, continue on until they are addressed. And because trauma is so complex, it can be very challenging to work through and to manage. And so, what happens in this complexity, in this very, very, very layered experience, we may not know where to go from it. We may not know how to navigate self. Again, there is that mental, that cognitive breakdown. So, not having the complete faculties to function in terms of logic, as well as the emotional impact, where it can be difficult to access certain emotions for fear, for things of not being able to put yourself back together, so to speak. And so, again, looking more broadly at what trauma is and the definitions and going deeper into those layers of it, what happens is when we experience a highly stressful or distressing event or experience, this can manifest now as trauma later on. Many of us may be familiar with things like PTSD, right? However, under that umbrella, there are other impacts that trauma can have that lead to mental illness and other mental disorders. And outside of the labels, right, the notion is that these experiences and these events and these interactions usually have a lasting impact on us beyond the actual experience of the trauma. So, again, in terms of speaking about the lasting impact, right, we can say get into a car accident, very traumatic car accident. Maybe it's your first time driving, you're scared on the road, your first time by yourself, you're in the middle of nowhere, you get hit. That accident has happened, right? Let's say it happened in May 10th. The accident happens, and then you find that May 15th, May 20th, you still have this fear of getting into a vehicle, this fear of driving on your own. Maybe even there's a fear of just imagining yourself getting into a car. And so you avoid cars altogether. And so maybe down the line, a couple months later, you still find that you're impacted by that traumatic experience that happened at that particular time. So with trauma, it leaves a lasting impact on us. And even in those instances where we believe that we may have recovered from those traumatic and very, very highly stressful experiences and events, there are still pieces of it that we may not be aware of. Because again, right, it has a mental, emotional, spiritual, social, individual component to it. And so it may take time, it may take intention, it may take a deeper level of healing to address all of those parts of you that were affected. Okay. So thinking about how it affects us, right? We think about how it affects how we think. So how we think about ourselves. Maybe we tend to be a lot more cautious about getting into vehicles. Maybe we feel the need to check people's driving history before we even get in the car with them if we have an accident, right? Maybe it even affects our ability to engage in certain activities that we have engaged in before, right? There's another aspect where it affects how we learn, right? So what happens in terms of our brain and in terms of the impact and development on our brain, if we have experienced a particular trauma that again has this lasting effect and it sets in, so to speak, we may not be able to access those different parts of our learning capacities and our learning processes that would allow us to really take in information and learn it and ingest it and understand it. Because maybe our brain is in a constant heightened position. It's in a constant heightened state, unable to calm down, unable to rest because there's this ongoing fear of, well, what would happen to me? Will this happen again? How do I stop myself from being in those situations where I'm vulnerable to this, where I'm at risk of this? And so looking at even our aspects of learning that are affected in our thought processes, our cognitive pieces, right? Those also influence how we act. They influence our behaviors as we relate to ourselves. And it also influences our behaviors as it relates to other people. So again, maybe in terms of our behavior changing and our thought processes changing, we may choose to avoid certain things. We may choose to avoid those situations that remind us of those traumas. Maybe we avoid those situations that, again, bring up distressing memories, distressing feelings, sensations in our body. Maybe when we're in those situations, we have heightened emotional responses. And again, it goes into not being able to have that resting period for your brain, that healing period for your brain and for your body too, because they're connected, right? And so, again, we think about the different challenges that may continue to develop as a result of these trauma. We can enter stages of constant sadness because we are unable to do the things that we used to do, because we don't see ourselves in the same way that we understand ourselves to be prior to the trauma. And so now going back and trying to get back to that self, I hear that a lot. I want to get back to who I was before. There may be constant anger and frustration because you can't go back. And going back would also mean, for some, reliving those experiences that were so painful in the first place. Maybe we enter states and episodes of depression. Maybe we enter different phases of our experience where we are unable to eat. We are unable to sleep peacefully. We are unable to get rest. Whether it's physical rest, emotional rest, mental rest, we are just unable to, again, achieve those levels of homeostasis within ourselves. And so that has lasting impacts on our experience with ourselves within, as well as the experiences outside of us. Maybe we're in constant states of worry and avoidance. Maybe as a result of the worry and avoidance, we develop bouts of anxiety, highly anxious states where we, again, are unable to think clearly. We are unable to concentrate. We are unable to focus. So, again, looking at those different challenges that result or that come about as a result of the trauma, they can enter into different aspects of our life. From a spiritual standpoint, maybe we begin to question a higher power that we believed in before, wondering, how could this have happened to me? What did I do to deserve this? Why am I being punished for this? And so again, our perception of ourself, our perception of the inner parts of ourself, and even those aspects of spirituality where we believe in a higher self or a higher power becomes shifted. Right? Maybe it even goes into those parts of our emotions where we get angry and we have certain outbursts and we can't understand why. And so if we're talking to someone and we yell at them and they didn't necessarily have a current experience that prompted us to yell, we were just in a heightened emotional state. Maybe we feel guilty about making the other person feel upset or sad. Maybe we feel shame for even allowing ourselves to get to that point. And so again, these emotional aspects, these emotional experiences that we have, we may separate from them. Because if the idea is that I tend to get angry in this very heightened emotional state and I feel bad about having this anger, I'm going to do everything in my power to avoid certain experiences that may trigger me. And so again, it limits our ability to live fully through that avoidance. Maybe on another level, in terms of our sleeping and eating habits, maybe we start to lose weight or gain weight. And in losing weight or gaining weight, we then develop issues with our body image, with who we see ourselves as. And so looking also at our sleep, right? Maybe we don't get good sleep because we have nightmares. Because the nightmares bring up, again, these very painful emotions that we have no idea what to do with. And so we avoid sleep, which makes us cranky, which makes us even more upset because we just want to sleep, but we can't. And the crankiness that comes out as a result affects other people, and we feel bad for not being able to control ourselves to the point where we now negatively impact other people's experiences. And so we stay up all night. Again, that rest that our brain and our body needs, we're unable to achieve it. And so all of these factors of our experiences that are impacted by the trauma can really put individuals, communities, families in a space where it feels lonely. You feel helpless, you feel hopeless, you feel confused. All of these emotions that come up for you, they become too much. And so for what some people do is they may try to escape. They may try to find other ways of coping through different distractions, through other unhealthy practices. We just want to get out of the pain. We just want to run from those experiences because they're too heavy. And that is what also makes trauma so lasting. Is the notion that we are unable to cope with it. But I'm here to tell you today that there is a way to learn, to heal, to grow, and to transform these experiences of trauma. Right? But we'll get to that. We'll work through that process. We'll connect how we can experience a heightened or a more improved sense of self-trust so that we can then lean more internally on the things that we have to help heal us through this process. But again, all of those aspects of ourself, of our individuality, of our families that are impacted, they have to be taken with care and they have to be addressed very intentionally. I mean, let's think about it, right? Let's use an analogy, for instance. Let's say, again, the car accident analogy, right? So in the car accident, you get bruised, you get scrapes and cuts, and maybe there's even a large cut, a large piece of your skin is scraped off, right? Maybe there's a burn, something, a physical injury, right? And so with the physical injury, what do? We clean it, right? We find somebody to help us take care of it if we don't do it ourselves, depending on how severe it is, right? Maybe we go to the doctor, the emergency room. And so with us cleaning it, we find that it begins the healing process. We clean it out, we make sure there's no debris in it, no dirt in it, so that it can heal without any infections. And maybe it does get infected anyway. Again, we do things to treat that infection. Maybe we put some sort of gauze or some sort of ointment over it. We wrap it up. Right? We wrap it. We bandage it. Wait a couple of days. We take the bandage off. Allow it to breathe. Right? Everybody knows that. They say, let it breathe. Let it air out. Right? So we let it breathe. We notice it's continuing to heal. The infection is no longer there. And so we keep doing what we're doing to facilitate that healing process. So we bandage it again. We put some more ointment on it. We cycle through. Let it get some breath. Let it get some air. And so with the air that it gets, we then say, okay, this healing process is working. We're still doing it, right? And so we let it heal. We watch it heal. The skin begins to grow back. The scabs come in. We see the scabs. The scabs fall off. More skin grows back. And then soon, maybe, if you're melanated like me, the color begins to come back. And so with the color coming back, we're able to look at it. We're able to see, oh, wow. that wound is healed. Right? So this is what happens on the outside, the physical process, right? What about our emotions? What about all the things that we were feeling at the time of the accident? The fear, the anger, the loneliness, the guilt, the shame, the uncertainty. What happens to all of those emotions? We can't see it. We can't put ointment on it. We can't clean them. They rest. They get stuck even. And they stay within us. And so that process of healing, right? We talked about cleaning it out, right? We talked about bandaging it up, adding some sort of substance to help, again, propel that healing process. We talked about wrapping it. That's what we have to do when we think about our emotional wounds. That is what we need to do in order to facilitate the process of our emotional wounds being healed. We get it out. We get it out so that it has air to breathe. We get it out so that we have space for more skin to grow in, for new experiences to come in, right? So what makes the trauma even more challenging is the fact that we can't see. We can't see with our mind, with our physical eyes, the full impact that the event or the experience has had. So it then makes the healing more challenging. Because maybe it's difficult for you to even put it into words, to let it air out. Maybe you feel like if you put it into words, people wouldn't understand you. Or maybe you have put it into words and people didn't understand. And they weren't able to empathize with you in a way that made you feel heard. That made you feel like people were aware of your needs and what you were going through. And again, maybe you just haven't even touched it because it's too painful to go through. Maybe focusing on the physical healing was at the priority, was at the forefront, because again, that's something that we can see. We can see that, so let's fix that up. But throughout that healing process and throughout the attention that we put into healing our physical body, our emotions just kept getting deeper and deeper, unable to be touched or felt even sometimes, right? So, and again, thinking about the impact of trauma, the cognitive part, right? Being able to put things into words, making logical understanding and logical statements about what has happened requires you to go back and think about it. And think about it in a way where it doesn't destroy you in the process. And that can be very challenging. So, what's next? How do we begin the healing process? Right? Well, let's start small. Let's start by, first and foremost, understanding this trauma. Understanding our traumas, whether it was family traumas, whether it was individual traumas, whether it was intergenerational traumas. Understanding that those experiences have happened. Right? But we first have to understand what trauma is. And then we can maybe acknowledge how trauma has affected us. And we'll just start there. We're not going to try to change it. We're not going to try to get rid of it. We're not going to try to fix it. let's just first acknowledge that it's there. And through our acknowledgement, we'll go through additional processes and additional understanding so that we can then get to a place of healing. But it takes time. It takes time. Okay. So, next time, we'll talk a little bit more about what that process looks like. We'll talk a little bit more about what it means to have that experience and what we're going to do next to facilitate that process of healing, that process of transformation. And of course, we'll tie in those aspects of trust that also have a very huge impact. Okay. So I thank you all so much for taking the time today to understand different aspects of your experience and to share space and to provide space for yourself. So we will continue this next time and have a wonderful rest of your week.